This video is a short training to help you use the Veterinary Digital Anesthesia Records program that we commonly use in anesthesia in both small and large animal patients to help record vitals. First, you're going to start off by double-clicking on the VetDar icon on the desktop. The next thing that's going to come up is the user login, which is VTHAX, and then you're going to hit login. Next, it'll come up with the formulary disclaimer, which you just hit accept. Up at the top left-hand corner, there's a purple drop-down menu. You're going to click that, and then you're going to select New Case. The New Case wizard will pop up. The first window will say Begin New Case, and you're going to hit Next. The next window is Resuscitation Code. This should be written on the anesthesia blue sheet hanging by our marker board in the prep room for each case that's filled out for the day. So you'll click whatever one is best suited to your patient, and then you'll hit Next. Patient information is the next step. For the patient ID, you're going to enter in the 6-digit code or patient ID number, whatever that is. And then you'll enter in your patient's name, species, and breed. Then hit Next, which is patient signalment is the next window. You'll select the sex and then whether they're spayed or neutered. Then you'll enter in your weight of your patient in kgs, followed by their body condition score, and then their date of birth. And then hit Next, which is owner information. So you'll enter in the owner's first and last name, their address, and phone number. And then hit Next. At this point, your wizard is complete, so you'll hit Finish. And then you're going to start in the upper left-hand corner where it says Patient Information. You're going to click on that. And this is under the Case Information tab because we're going to go through one by one under each tab. So we'll start with Patient Information. It's going to come up with the patient information that you already entered. So as long as that's correct, you'll hit Save and Next. Then it'll come up with the owner information again. If that's correct, then you'll hit Save and Next. Next is Procedure. Here it has a bunch of different things that you have to fill out. The resuscitation code is the first one, so you'll just make sure that you selected the correct one, or you can go back to this button and change it if for some reason the resuscitation code is different than what you had originally put in. Then you're going to select inpatient or outpatient, and then you're going to select the recumbency that your patient's going to be in for surgery. If you're not sure what your recumbency your patient is going to be in, you can always come back to this window and fill it out later. Then the next one is procedure date, which is the date of the procedure. So if for some reason you make a patient's or you set up a patient on the computer and then the procedure gets pushed back a day, you can just go back in to the case and change the procedure date to a different day. Then table time and length, whatever the table time for your patient is and whatever length you think your procedure is going to be. Next, you're going to select the procedure by clicking where the pointer is to add a new row. Here there are a bunch of procedures that are already entered in. If for some reason the procedure you want is not here, you can click Add New. It's going to pop up that you must be logged in as an administrator to access this feature. So you'll hit OK. And then the administrator login is admin, and then the password is admin. So then you'll hit login, and then you can add the new item here. Once you add the new procedure in, you'll hit add and then X out of the window, and then you have to hit save changes and come back in to the same window for you to actually see the new procedure listed, and then you'll select it. Once you have your procedure selected, you'll hit save and next. Here you're going to put your participants. So if you're accessing this program for the first time, you're going to have to add your name just the same way you added a procedure. So you'll have to click Add New and then add in your name, and then you might have to hit save and then go back into the participants window. And then you're going to add yourself as the anesthesia student. You need to also list the anesthesiologist that signed your protocol, the anesthesia technician that is working with you on the case, the clinician that is on the case, whether that be the cardiologist, the radiation therapist, the surgeon, or so-and-so. And then you also need to add the resident on the case. These are the most important ones to list on the procedure. We try to not list everybody in the room just because there would be so many listed on the side of the record. Then you'll hit save and next. The next is the patient signalment, which you've already entered in, so you'll just make sure the information is correct, and then hit save and next. Next is your physical exam. So this will be what you found on cardiac auscultation and your respiratory auscultation. If it's normal, you can put within normal limits or WNL. Additional comments would be any other abnormalities you found on your physical exam. Then you'll hit save and next. Lab results. This is most commonly going to be your big three, so your hematocrit, your total protein, and your glucose. You'll select your hematocrit, you'll enter in your value, and then you need to do your units, which is going to be %. And then you'll click on test, and then you'll click here to add a new row. And then you'll select glucose, put in your number again, and it's going to be milligrams per deciliter. And you'll hit enter, and then hit test again, click here to add a new row, and then you'll enter in your total protein. Okay. And this will be in grams per deciliter. Then hit save changes, and now you are complete with the case information tab. So you're going to click patient assessment and start from the left going over. So you start with the general considerations. So you'll click on that, and it'll come up with potential complications for your procedure. So you're going to click here to add a new complication. Some of the most common complications that we have are hypotension and bradycardia. And then you'll select anything else that is pertinent to your case or any potential complications that you have. Then you'll hit save and next. Pre-op evaluation. This is going to be your history. This can be copied from the medical record in the HIS system, from the history of the patient. So just include the most pertinent to the case, and you'll copy and paste it here. And then you'll hit save and next. Here you're going to enter your pre-medications, whatever those may be, along with your drug dosage in mg per kg, and then your route. And then you'll hit save and next. Induction, you're going to enter your induction drugs, and then your mg per kg, and your route, and then hit save and next. Next is your analgesia. This can be a very broad topic, especially when we're doing procedures like TPLOs. We can have multiple things that are going to be listed under this. Examples would be additional doses of hydromorphone, your drugs for your epidural, your morphine and bupivacaine, and then also your NSAID, as well as any nerve blocks or any CRIs that you're going to run to help with the analgesia. So you'll list all of that in this area, and then you'll hit save and next. Recovery concerns, you'll list all your recovery concerns here. The most common are going to be pain and dysphoria. Then you'll hit save and next. Maintenance and monitoring, here you'll enter in your maintenance agent. So whether that's isoflurane or if you're going to do an intravenous protocol, you'll enter that in as well. And then you'll write in your oxygen flow rates, whatever you've calculated it to be. And then you'll also write in your intravenous fluid rates. And then you're out. And then you'll hit save and next. Next, it'll come up with the fluid bolus volume. You can skip this one, as well as the ventilator settings, because at a later time it'll come back and ask you your ventilator settings. So hit save changes. This will complete the patient assessment tab. Next, you will go to pre-induction. Here is where you're going to actually write down the times of your drugs when you give your pre-anesthetic. So you'll click the box below drugs and select your pre-med. And you're going to write your dose again in mg per kg. And then your route. And then here you can do your time that you gave your pre-meds. If you want to go ahead and enter your drugs in beforehand, you can come back and change the time. So then to add another drug, you can click the drug thing again and then click here to add a new row. And again, enter in your mg per kg of your next drug. And then once you have that, you can hit save and next. If your window ever disappears, you can just select down at the bottom, and it's probably just gone down at the bottom, so you'll hit that. Physical status, you'll select the physical status of your patient, whichever one is most appropriate. If you're doing emergency at night, make sure you check the emergency box. Here you're going to enter in your heart rate, respiratory rate, and body temperature from your physical exam. Okay, and then any additional comments here, you can list things like if your patient has a murmur or anything else that is pertinent from your physical exam, you can write it here that may have affected your physical status. Then you'll hit save and next. And then here you're going to enter in your sedation present. So none would be no effect whatsoever. Mild would be just some sedation. Moderate would be pretty sedate. Marked would be almost intubatable. So then you'll hit save and next. Then it comes up with your induction. Here you're going to enter in your induction drugs and your time. Make sure you select the method of induction at the top. IM would be for TT Dex. IV obviously would be for like propofol or etomidate inductions, and inhalation we use in radiation therapy. So here you would select inhalation if you were going to mask down your patient. When you select your drug, you'll put your dose in mg per kg, and then your route, and then your time. And like I said, you can go ahead and enter this in beforehand, and you can always come back and change your times. And hit save and next. It's going to come up with your maintenance system. Here at the top, you want to make sure to select the maintenance system you're using. So whether it's a semi-closed circle or a non-rebreathing, or if for some reason you're doing a TIVA protocol, you can select the IV. Here you'll select below drugs and enter in your agent, and then for your dose, you're just going to put your value in that you started on your vaporizer when you first went under anesthesia or you first turned it on. And then you're going to select your route, which most of the time is going to be inhalant, and then you're going to put your time. And again, like I said, you can come back and change your time if you put it in beforehand. And then hit save and next. Intubation, you're going to click ET tube. For some reason it defaults to nasal, but you're going to always want to change it to oral because very rarely do we do nasal intubations. And then you're going to put your size tube that you used. Then hit save and next. Next, it's going to come up with catheterization. You're going to click here to add a new row and select wherever you put your catheter. And if you have multiple catheters, you can click up at the top and then click here to add a new row and select the multiple places you placed your catheters. Next, you're going to select your fluid type, so you'll click here to add a new row and then select the fluid that you're using. And then your dose, you can either do in mils per kg per hour or mils per hour, either one, as long as it's correct. And then your route. And again, if you have multiple fluid types, you can click at the top and then click here to add a new row. And then hit save and next when you're done. Next is blood pressure monitoring. This is a very important part because this determines what's going to pop up on your windows when you're doing your recordings. So you'll want to make sure you select the right one. Non-invasive would be if you're not going to place an art line. So if you're not sure if you're going to place an art line in your patient, it's better to click the non-invasive invasive because then both options will come up on your readings. If you're in large animal and you don't ever put a non-invasive cuff on, you can select invasive and then the non-invasive won't ever pop up. So, and then if you are using non-invasive, you'll enter in your cuff size on your patient and then hit save changes. That will complete the pre-induction tab. So the next one is going to be your induction maintenance. This tab is when you're ready to begin anesthesia. This is where we recommend when you're first using this program, you have another person to help you, just by helping to start this while you're still getting all your monitoring stuff on. So as soon as you induce, you can click the begin anesthesia button and it'll pop up and ask for your vaporizer settings. So you'll enter in that. And then it'll ask for your oxygen flow rate, so you enter that in and hit save changes. Then it will give you about 3 minutes before your first reading, so that kind of gives you time to get all your monitoring stuff on your patient. When your reading pops up, you will enter in the vitals that you have. So you're always going to get your heart rate from your patient, not from your ECG. So either that's going to be through Doppler, auscultation of the patient, or through your esophageal stethoscope. So you enter in your heart rate, and then you can tab down, enter in your respiratory rate, pulse ox, CO2. Expired agent we only have on some of our monitors, so if you're not sure if the monitor you have has that on it, you can always ask the anesthesia tech on your case. And then you're going to click on whichever blood pressure you have. So more than likely you're going to be starting out with non-invasive in the very beginning. So you're going to enter in your values off of that. So you'll enter in your systolic, diastolic, and your mean blood pressure. And as you can see, it's checked each box that you entered a number in. So if for some reason you leave a box blank but it is checked, you will never be able to go back and change this value. It's going to record it as 0. So make sure you don't have a box checked that you don't have a value for. And if for some reason you don't have your blood pressure on the first reading, you can always get it on the second. So just don't enter any numbers in and make sure your boxes are unchecked. Then you'll hit save. And then it'll keep counting. So it's kind of nice because you can always keep your window up. So if you don't get it just so the very second that it popped up, it'll stay up. And it'll keep counting for the next 5 minutes. So if it takes you a little bit longer on the first reading, you might have another reading pretty quickly after that. Some other things up here at the top. Very commonly, we're going to give medications during anesthesia. So things like antibiotics, if you're going to do an epidural, NSAIDs, additional doses of hydro. For all of those, you're going to have to click up here and click add medication. And you're going to enter in your drug. If it's a CRI, make sure you only enter the CRI in once. And then for the additional, I'll show you how to enter it in down below if you're going to change your rates. But up here, we'll pretend like we're going to do cefazolin. So we'll select that and then do our dose in mg per kg. And then our route, and then reason would be antibiotic. And then you'll hit add and then save. So you'll do this for multiple drugs. If you wanted to give hydro, you'll put that in here as well. Your dose. And then the reason would be pain management. Okay. Make sure that you don't select maintenance, because maintenance would be like isoflurane. So if you say maintenance or pre-anesthetic or induction under these reasons, it's going to show up back in those windows that you filled out before. So make sure you select the right reason. If you're not sure, then just select other. And then hit add, and then save. So as you can see that those remarks popped up at the bottom. So the other thing you can do is if you ever need to enter anything, like say you added a CRI and then you change the rate, you can click here and type in your rate change. And then hit enter, and it's going to record the time. And if for some reason you need to change the time, you can always hit select and click it there and change it. Same thing applies if you messed up a time for the start of anesthesia. If you messed up when somebody clicked the button, or say you didn't have somebody to help, you can go back and change that time. You can also click up here on this little arrow, and it will also let you change your times for both anesthesia start, anesthesia end, recovery end. If for some reason you forgot to select it at some point, you can go back and edit it. And then if you need to record an extra interval, say your patient dramatically had a change in values, you can hit here and that will pop up. So you'll put in whatever you need to and then hit save, and that'll pop up as an extra interval reading. Also, if you make a mistake, you can click this View Data button up at the top and then double click on the value you messed up on and change it. You can only change values that were entered though. So you'll change it to the value you want, hit Save Changes, and then X out of the window. And if you ever have something else pulled up, when the next recording comes up, it's going to default to that recording. So it'll make you enter that in before you can change anything else. If you are in transit and you just leave up the recording, it will stay there. So you'll enter in your values. And then hit save. The temperature will pop up every 15 minutes. So after about 15 minutes, it will pop up with your first temp reading, and it'll go every 15 minutes from there. One other thing up at the top, at the very beginning, it asks what your vaporizer and your oxygen settings were. If you change it after that point, you have to click the button at the top. So for vaporizer setting, you'll click this button, and then you'll hit change. Change there. And then if for some reason you were a little delayed on when you entered it, you can always change the time here, and then hit save. Same thing with your oxygen flow. When you turn it down, you just want to make sure you click the button up at the top and then hit save changes. Another common thing that we do is putting patients on a ventilator. So when we turn on the ventilator, we're going to click this button up here at the top. Then it'll come up with ventilator settings. If for some reason your tech's too busy to answer these questions about the tidal volume, inspiratory pressure, IE ratio, and rate at the time that they're getting put on the ventilator, you can just hit save and it'll pop up in the bottom, and you can always click it and change it to your values. Usually your tidal volume is going to be 10 to 20 mils per kg. And then inspiratory pressure just depends on the size of your patient, but no more than 20. And then most of our Hallowell ventilators are a 1:2 ratio that we have. And then whatever your breaths per minute is, you'll put that in here as well. And then hit enter. Again, if you need to edit your time, you can always click over here. Or like I said, you can click up here at the top and edit your time for your ventilator start time. Sometimes if you change it in your remarks, you might have to still go up here to the top and change it, because it doesn't change it in both places. Same thing if you mess up one of these values for your drugs. If you change it down here, it's not going to change it, so you might have to go back up to this window and then click on it and edit it there. Okay. The next thing is to begin your procedure. When your surgeons begin cutting, you can hit begin procedure and then select the procedure that you had. Click it there, then hit begin procedure. Again, if you messed up your start time, just change it here and hit begin, because otherwise if you do it now, you'd have to change it here and up here in this window. If for some reason you have a procedure, you can click up here if it's a little bit different. One perfect example would be a phaco emulsification. You can click on the window and edit it. So you can put phaco emulsification, OS, OU, or OD, just to be a little bit more specific. Or you can add, like I had a retinopexy added to mine the other day, so you can put plus whatever and you can edit it here, rather than adding a whole new procedure for something a little bit more specific. Then hit save. Another common thing we do under anesthesia is blood gases, especially in large animal. So you'll click the button up above that says blood gas. And then you'll select your source. And you can click venous or arterial. And then you're going to enter in all your values that you have on your blood gas. Okay. Here you can also enter in, if you did a PCV and total protein, you can enter that in here as well. Or you can put in your remarks either way. And then same thing if you're doing glucoses, if you have a diabetic patient, you can enter in your glucoses here as well. And hit save. And then it's going to come up with blood gas results entered, and that will show up on the final papers at the very end. Or like I said, you can enter in your values as a remark as well. When you are done with the ventilator, you can hit turn ventilator off. When you're done with the procedure, hit end procedure. And then when you're done with anesthesia, hit the end anesthesia button. And it'll ask you, do you want to continue recording patient data? You're going to most likely select no. Then it's going to come up with finish anesthesia. So here you're going to want it, these will be your medication totals. This window is also accessible during the anesthesia, so you can not have to enter in so much at the very end. So if you go back and you hit the recovery tab, you can select medication totals, and here you're going to enter in your milligrams that you gave of each drug. So for ACE, we're going to enter in the milligrams. So it would be that. And same thing with your Cefazolin and your Hydro, you're going to enter in all your milligrams. For your fluids, you're going to enter in your mils. For your propofol, make sure you enter the amount you gave, not necessarily the amount you calculated, since that's a to-effect drug. So you're going to enter in however much you actually gave to your patient, because you may have calculated more or you may have calculated less. And then once you have all those in, you're going to hit save. When you go to extubate your patient, you're going to click and make a remark. So most of the time we just write extubated, and then make sure the time is the time of extubation or extubation, and then you're going to or you can just write to the side extubated at whatever time, and then on that same line you're going to put in your final TPR, whatever that may be. And then hit enter, and that'll save it. Sometimes your remarks might disappear, so just make sure that while you're monitoring that your remarks are actually showing up. And you've seen me do, you can drag this up and down so you can see your remarks better. Because sometimes if you don't click enter and you just click off the line, it will disappear. So just make sure that all your remarks have gotten entered and that you keep up with that. We do have little notepads, so when a case gets pretty intense, you can copy down the drugs given and then catch up on the computer at a later time. Once you're extubated, you're going to hit recovery complete. And then you're going to do the recovery quality. So you're going to just select from the menu, the drop down, and just select whichever one applies best to your patient. So, and then in the comments, you'll just write comments for whatever best applies. If, say, your patient was dysphoric, you can put that in there. Or you can say had to give multiple medications. For large animal, in the comments section, you'll want to record your recovery score, 1 through 5 there, and then you'll hit Save Changes. And then complications, you'll click there and click here to add a new row. If you had a complication, you can put that, select it from the drop-down menu, all that, and hit Save Changes. And then once you're done, you're going to show this to your anesthesia technician on your case, and they're going to go through tab by tab and make sure that you have everything entered in correctly. And then once that is done, they're going to hit Submit Case for Approval. And then your case is done.